Hey, brother, pause for a moment. This might save you years of discomfort and fear. You may think your favorite position is safe, but are you sure it doesn't scratch, tear, or burn your skin each time? According to 2025 U.S. health surveys, more than 60% of men over 25 develop penile inflammation linked to improper positions and dry friction, not just STIs. These micro-injuries become silent gateways for pain, infections, and HIV symptoms that repeat after intimacy. So, no, positions don't stop HIV, but some can protect your skin and your peace of mind by reducing tears and redness. In this video, I'll share 5 positions you should rethink and why they matter for your future confidence. And before we end, I'll unveil the 20-2-2 rule, a simple daily method to restore balance and safety in your sex life. If that sounds valuable, hit subscribe and comment 1, so I know you care about your health the smart way. Alright guys, we're moving from vague anxiety to hands-on calm control. Men 25 plus in America juggle work, relationships, and workouts, and that strain can make penile skin drier, tighter, and more vulnerable to friction. I'll guide you through 5 safer positions, a no-nonsense lube and condom checklist, and a testing game plan aligned with US Windows. Take notes, ask questions, and use what works for your body. This is practical medicine for real life. We'll start now, deliberately and respectfully. For the next minute, let me explain why positions matter more than most men realize, and why the wrong angles quietly turn good nights into lingering problems. Friction sounds harmless, but biologically it increases shear force on delicate penile skin, creating microtears you rarely see, yet clearly feel the morning after. Those tiny breaks invite inflammation, swelling, and stinging. Inflamed tissue recruits target cells like CCR5 expressing T cells, doors pathogens prefer. Add sweat, salt, and missed showers and irritation compounds, leaving skin drier, tighter, and less resilient with each intense session. When microtears repeat, you notice patterns: recurring redness along the corona, faint cracks at the frenulum, a sour odor after workouts, or thin morning discharge. None of these means an STI, but irritated tissue lowers your pain threshold, increases anxiety, and can blur judgment about when to test or seek care. Angles matter because pressure concentrates where tissue is thinnest. Extreme curvature or deep thrusting at speed magnifies contact at the same few hotspots, multiplying microscopic injuries. Control matters because tempo changes biology. Slower entries, shorter strokes, and intentional pauses let tissue rehydrate with lubricant and reset sensation before irritation crosses your pain line. Positions that let you manage depth and rhythm reduce cumulative shear. Less shear means fewer breaks, calmer inflammation, and fewer gateways that symptoms or infections can exploit. Think practical. Choose forms that keep hips aligned, avoid sudden bends, and allow a quick stop when heat or sharpness appears. Prevention beats creams you buy tomorrow. Remember, we are engineers of our skin health. Change the geometry and you change the outcome. No bravado required. Respect for anatomy and recovery time. If this makes sense, type TEP TUK so we move on. And keep this mini hook in mind. When you control angle and speed, irritation risk drops dramatically. Alright guys, here is the practical part most men wish they learned earlier. These 5 positions reduce friction, protect thin tissue, and give you immediate control over depth and rhythm. 1. Side-lying spoon. Both partners lie on one side, hips aligned. Low rubbing angle, easy pacing, and minimal bending at the base of the penis. It is gentle after gym days or cycling when skin may already be irritated. 2. Partner on top. Your partner controls depth and cadence, so thrusts land softer and more predictable. This reduces bottoming out at the base and the sudden jolts that cause micro tears. Q3. Slow missionary plus pillow under hips. A small pillow lifts the pelvis, flattening the angle and spreading force across a wider area. Use generous water-based or silicone lube and shorter strokes to keep tissues calm. U4. Edge of bed. Partner lies near the mattress edge while you stand. You can step back instantly if heat or sharpness appears, and you can visually check hot spots on the skin in real time. E5. Side by side, face to face. Both of you lie on your sides, bodies close. Lower inertia, slower momentum, and effortless eye contact make communication natural, which helps you adjust before irritation builds. Comment 1-5 with the position you feel fits your body best, and we will move to application. Correct lube choice, condom fit, and pace control habits that prevent repeat irritation. Remember this mini hook. A safer position is the one that lets you stop the moment your skin speaks up. Bodies differ. Stay present, hydrate, and moisturize after intimacy to support recovery and respect any sting, heat, or tightness as stop signals. You picked a safer position, but irritation still shows up. Let me explain the unspoken reasons most doctors skip over in quick appointments. Even with gentle angles, tight foreskin, phimosis, eczema, or a mild fungal rash can turn normal friction into micro tears. Freshly shaved skin is also more vulnerable. Close trims leave rough stubble that scrapes partners and your own glands during movement. Hard workouts change the equation. Sweat, salt, and long hours in tight underwear shift skin pH, dry the mucosa, and make lube evaporate faster than you expect during long sessions. That warming or scented lube. Many contain alcohols or fragrances that sting irritated tissue and amplify heat at the frenulum and corona. What felt exciting at first can escalate into burning, redness, and next morning soreness. Condom fit matters just as much as position. If it is undersized, it strangles, increases pressure, and drives friction into the same hot spots. If it is too loose, it bunches, slips, and rubs edges unpredictably. All of this explains why safer is not risk-free. Your skin history, grooming, training load, and product choices either calm the surface or set it up to fail. The minute pace increases. Here is the practical takeaway. Patch test new lubes on the inner forearm. Favor water or silicone-based products without fragrance or warming agents. Match condom size to girth, carry 2 sizes, and change early if dryness or heat builds. I stand by this clinical truth. One wrong lube can ruin a right position. If this clarified something you have been wondering about, drop a like so more men can find it today. One bad lube choice can sabotage an otherwise perfect position. Don't stop here. This section upgrades comfort, reduces irritation, and quietly boosts your partner's pleasure. Condom. Fit and standards. Choose the right size. Regular or large based on girth, not ego. Check the expiration date and packaging integrity before every use. Look for ASTM or ISO marks for quality. Cheap novelty condoms often lack reliable testing. If a session runs long, change to a fresh condom before dryness and heat build. Lube, type, and reapplication. Use water-based or silicone-based lubricants for latex condoms. Avoid oils with latex. Oils weaken latex and raise failure rates. Skip warming, flavor, and fragrance if your skin is reactive. Reapply whenever glide drops. A quick pause now prevents a rough tomorrow. Skin prep. Simple, clinical, effective. Shower after the gym. Salt and sweat alter pH and dry the mucosa. Pat the glands and sulcus dry. Moisture trapped under the foreskin fuels irritation. Use a fragrance-free moisturizer, think sensitive skin, not cologne. Trim hair with guards instead of close shaving to avoid abrasive stubble. Where to buy? Discreet and reliable in the U.S. CVS, Walgreens, and Target carry multiple sizes and lube types. Use self-checkout or order pickup. Privacy matters and consistency matters more. Store a travel kit, 2 condom sizes, a small lube, and moisturizer. Rotate brands slowly, 1 change at a time, and patch test new products first. Your partner will notice the difference. Small prep signals care, safety, and maturity. It is not flashy, but it prevents the very micro tears that start bigger problems. Sometimes the unsexy checklist is exactly what saves your skin. If you are asking when and how long, this is the timing that turns fear into a plan you can trust. Start with a 4th-generation antigen antibody test. Test at 3 and 4 weeks for an early read, again at 6 weeks for strong reassurance, and at 3 months for your definitive result. If exposure felt high risk or anxiety spikes, add an RNA test earlier. RNA detects sooner, but always pair it with 4th gen at the standard windows to confirm. If a potential exposure was within 72 hours, ask immediately about PV. Post-exposure prophylaxis works best when started fast. Every hour matters for effectiveness. Remember, you choose you. Undetectable equals untransmittable. With consistent treatment and an undetectable viral load, sexual transmission does not occur. That truth restores confidence, intimacy, and peace of mind. Screen for other STIs because inflammation changes risk. Gonorrhea, chlamydia, and trichomonas increase target cells and micro tears, raising both symptoms and measurable probability. Make it practical now. Set reminders for the 3-4 week, 6 week, and 3-month checkpoints, and schedule testing at a trusted local clinic. Choose settings that respect privacy, urgent care, community health centers, or LGBTQ+ friendly clinics near you. Bring a photo ID, insurance if available, and ask for 4th generation by name. Do not overtest too early. Biology needs time to reveal markers. A negative at 1 week isn't final, but it begins a steady, predictable path toward clarity. You're not alone in this process. Follow the schedule, breathe, stay organized, and keep a perspective each step. Mini hook number 5. The right test at the right time erases most fear that comes from not knowing. As promised, here is the practical plan you can use tonight or share with someone you care about. Written for real life and grounded in clinical experience. Follow my 5-step framework. 1. Choose one of the 5 safer positions that fits your body and flexibility. 2. Match condom size to girth and pick a lube your skin tolerates. 3. Pace pause, 60 seconds per cycle. If heat or sting appears, stop and reset. 4. Rinse with warm water, pat dry, then apply a fragrance-free moisturizer. 5. Keep the testing protocol. 3 and 4 weeks, 6 weeks, and 3 months, plus RNA if needed. Now I will reveal the 20 to 2-2 principle I promised. The small routine that changes outcomes without drama. 20. Spend 20 seconds actively lubricating before penetration and refresh lube between segments. Glide prevents micro tears far better than any cream afterward. 2. Every 2 minutes, scan for hot spots with your fingers and attention. If you feel heat, tightness, or sharpness, lower depth or change the angle immediately. 2. Finish with 2 layers of aftercare. Warm water cleanse and thorough dry, followed by a light, unscented moisturizer to restore barrier function. You do not have to change who you are to change your results. You only need new habits and steady awareness. Share this with your partner, agree on stop signals, and keep a checklist you can follow calmly at home. You do not need a new self. You need a new routine. Do you know where the real leverage is? Mindset. When both of you feel safe and seen, the body relaxes and communication opens. Practice presence over performance. Slow your pace. Ask simple questions. Listen for real answers. When you prioritize comfort over a script, you prevent friction before it starts. Set clear boundaries early. Agree on a safe word or a stop signal you will honor without negotiation. Decide up front that changing positions is normal care, not a failure. Use plain American English and short phrases. Try this line. Let's go slower for a minute. It feels a bit hot here. Follow with, how does this angle feel for you? Then pause 10 seconds and wait. Create a calm environment. Lights soft, towels ready, lube within reach, phone on silent. Preparation lowers stress and makes speaking up feel easy and natural. Check in at predictable moments. During the 2-minute scan from the 2-to-2 routine, ask, any hot spots? If yes, shallow the depth, change the angle, or switch to a lower friction position. Respect red flags. Heat, sharpness, or tightness are anatomy speaking, not challenges to overcome. Stop, breathe, and reset. Confidence grows when you protect comfort first. Aftercare matters. Say, thank you for telling me. Acknowledge any discomfort and agree on small fixes for next time. Trust compounds when feedback becomes routine, not drama. If any part of this felt familiar, comment the word cam thong. Or write compassion if English feels easier today. Your voice helps other men choose presence over pressure, and that choice protects skin. One sentence can prevent half of micro tears. Meet Jack, 28, a software engineer who lifts heavy 3 days a week. After leg day, he preferred deep, fast thrusting with little lube, believing natural is better and pain means strength. By Monday mornings, the rim of his glands looked angry red, with tiny fissures at the frenulum and a sour post-gym odor he blamed on laundry. He saw me after a month of repeating soreness. We reviewed angles, tempo, and lube. I explained that friction plus tight quad days equals fatigue, stiffness, and less hip control, all multiplying pressure on the same hot spots. His favorite position repeatedly bent the base, turned thrusts into jolts, and produced micro tears. We made 3 changes. First, we switched to side-lying spoon and partner on top, letting his partner control depth while Jack focused on steady breathing. Second, we replaced scented warming gel with a silicone-based lube for sustained glide. Third, we added the 2-to-2 routine and a post-intimacy rinse-dry moisturize ritual. At week 3, redness faded, morning discharge stopped, and confidence returned. Here is the same blueprint you can follow, written for American life and busy schedules. 7-day routine. Monday, light cardio for circulation, then a warm shower. Pat, dry the glands and sulcus. Apply a fragrance-free moisturizer. In the evening, choose a low-friction position. If intimate, re-lube at 2-minute checks and stop on heat or pinch. Tuesday, strength train if you wish, but wear breathable underwear. Hydrate more than usual. If you notice sting, skip intimacy and treat skin like sunburn. Gentle rinse and moisturizer, nothing perfumed. Wednesday, cardio day again. If intimate, confirm condom size, prime with 20 seconds of lube, and practice shorter strokes first. Scan for hot spots at minute 2 and minute 4. Thursday, rest hips and groin. Trim hair with guards. Avoid close shaving that leaves abrasive stubble. Review your testing schedule and set calendar reminders. Friday, social night, easy pace. Stock your kit. 2 condom sizes, small lube, and moisturizer. Use partner on top if soreness lingered earlier this week. Saturday, longer session. Edge of bed gives instant control and visibility. Refresh lube when glide drops, not when burning starts. End with warm water, thorough dry, and moisturizer. Sunday, recovery and reflection. No goals, just presence. If the week included any unusual discharge, sores, or persistent odor, plan STI screening and keep the 3 checkpoints for 4th-gen testing. Red flags. Seek care early. escalating pain that outlasts one day. Yellow or green discharge. Persistent foul odor. Ulcers that do not heal within a week. Fevers, chills, or swollen groin nodes. If this section gave you a clear plan, comment, "I choose control," and I will pin a printable checklist for you. Clarity beats fear, and a calm routine beats guesswork every time. Your skin is not a test of toughness. It is equipment you protect. Treat it with respect, and it will protect your future. Build rituals around consent and check-ins. They transform intimacy into teamwork and safety. Small, repeatable actions compound results, just like training, sleep, and hydration compound performance. Consistency builds protective habits. Thank you for staying with me to the end. Now, let's lock in what you gained today. Positions are not a biological shield against HIV, but the right geometry reduces friction, micro-tears, and inflammation. And that means fewer penile symptoms and fewer pathways problems can exploit. That's the shift from fear to control. Remember 5 safer options. Side-lying spoon for low angles and easy pacing. Partner on top, so depth and cadence stay predictable. Slow missionary with a small pillow to flatten pressure. Edge of bed for instant step-back control and visibility. Side by side, face to face when you want low inertia and effortless communication. Use a 4th generation test at 3 to 4 weeks, again at 6 weeks, and once more at 3 months for final confirmation. And consider an RNA test early if anxiety is high. If exposure was recent and meaningful, talk to a clinician about PEP within 72 hours. Speed matters. Hold on to you equals you. Consistent treatment leading to an undetectable viral load means no sexual transmission, a fact that restores confidence and intimacy when used responsibly and verified by regular care. Own the habits that keep skin calm. Fit the condom to girth, pick a simple water or silicone-based lube, reapply before dryness. Shower after workouts, pat dry and moisturize with something unscented made for sensitive skin. Then apply the 20-2 principle we covered. 20 seconds of lube, 2-minute hotspot checks, and 2 layers of aftercare. Masculine self-respect is not volume or speed. It is care, communication, and pace control that protect both bodies and trust. Presence over pressure. That is the mark of a grown man. If you want more doctor-backed sex health for American men 25+, please subscribe and share this with one friend. One share today can spare someone months of anxiety. Thanks for being here, learning, and choosing control. Today.